Hello, everyone. My name is Dr. Marcela Dominguez. I'm one of the staff at the Susan Samueli Integrative Medicine Institute. And my topic today is integrative medicine approaches to COVID prevention and recovery. And I will be emphasizing the particular topic of long COVID syndrome or COVID long haulers. Let's go ahead and get started. I feel in order to best understand where we are today, it's a good idea to travel down history lane a little bit. So December 31st, 2019 was the very first case of the SARS coronavirus 2, otherwise known as COVID-19 viral infection, showed up in Wuhan, China. The second case showed up in Thailand, January 13th, 2020. So that was the second case outside of mainland China. And as you can see from this slide, as of April 18th, 2021, we have over 140,300,000 confirmed COVID-19 cases. And of those, we've had over 3 million COVID-19 related deaths. And I think it's important to know worldwide that there have been 751,452,000 vaccine doses given, just probably a little bit more than that, but you can see that there's quite a large number of people that have been vaccinated in the world. If we look specifically in the United States, we can see that there have been 31,444,706 COVID-19 confirmed cases. And of those, 563,980 COVID-19 related deaths. And specifically to California, I think it's important to know that on the 17th of April, as an example day, we had 2,763 confirmed cases and 103 deaths. And I'd like to just compare that to our peak number in California, which was on December 16th, 2020, which was 53,711 cases. So we've dramatically brought down those numbers, and it's definitely heading in the right direction. If we take an even closer look, getting closer to our hometown area of Orange County, at this moment in time, Orange County is in the moderate zone as far as the level of community transmission of COVID-19. As of April 15th of this year, we can see in the last 7 days that 1,270 people of the 3.2 million people living in Orange County were confirmed COVID-19 infected patients. That's an increase of 23.5%. And we've had deaths decrease 7.7% down to 60. We've seen hospital admissions go up slightly to 154. And ICU beds have stayed about the same for COVID-19 patients, about 4.5%. And you can see in Orange County, we have vaccinated 805,130 patients, which is 25.4% of the Orange County population. But of our seniors, 65 and over, we have vaccinated 317,764 patients, which is 65.4% of that population. And very specifically to UC Irvine, we have just surpassed the 100,000 mark as far as vaccines given at UC Irvine. So now that we have a little bit of just background information to realize and appreciate how dramatic this COVID-19 pandemic has affected all of us worldwide, but very specifically even here in Orange County, we're going to go ahead and transition over into my more specific topic. The name of the topic is medically termed post-acute sequelae from COVID-19, which the acronym we use is PACS. And this is also familiar to people as a long COVID syndrome or long haulers. And there are many different ways of describing this particular situation of illness, PACS. There's an organization called the Body Politic COVID-19 Support Group. And this is a support group of citizens in the community, mainly scientists, that provided 640 respondents, and they notified through the support group the various symptoms that they were experiencing. And their first draft was the first time that we even had a description of this long COVID syndrome based on these self-reported experiences. We also had a better definition as we were gathering this information that this long COVID syndrome is really a collection of over 200 symptoms that last longer than 28 days. And they can affect different bodily systems, including the heart, lungs, the gastrointestinal system, muscles, joints, the nervous system, and the neuropsychological systems. When gathering this information, 96% of the patients that were reporting symptoms had symptoms lasting longer than 90 days, and even 82% had symptoms reported longer than 6 months. Most common symptoms that were reported include the ones that are listed here: fatigue, post-exertional malaise, and also post-exertional increased fatigue. Cognitive deficits, which had a lot of different variable presentations, shortness of breath, and trouble sleeping. You can see 88% of the 2,464 people had these above symptoms, which is a majority of them. And these symptoms affected their activities of daily living. And 98% of these self-described long haulers represented 56 countries. And these people, 98% of them could not work full time. So this is obviously a very important component and result of COVID-19 infections. Another very large patient-led survey was done by the University of London to try to evaluate more carefully and in more detail this long COVID syndrome. You can see here there was 3,762 participants, mostly women, and mostly between the ages of 30 to 60 years old. These were people living in the United States. And these were people that either had COVID based on symptoms and criteria, and or they were positively tested for COVID. It did include both sets of people. And there were average of 14 symptoms reported. And the noticeable relapse symptoms primarily occurred when people did exercise, when they had any increased mental activity, and or when they had daily stress. So nearly half of these participants had to reduce their work hours because of these severe symptoms. And you can see 22% of them couldn't work at all. And on average, we had kind of a very specific differentiation between two categories. We had people who had symptoms that lasted 90 days or less, and their peak symptoms occurred around week 2. And then you had a population of these patients who had symptoms lasting longer than 90 days, and their symptoms peaked at month 2. So very interestingly, we had kind of a separation of these particular types of long COVID long haulers. There's yet another large database to help identify a little bit more detailed experience of these long haulers. And this is the UC CORDS data, which stands for the UC COVID research data. Multiple locations were a part of this very large database: UC Irvine, UCLA, Indiana University, University of Miami, and Mayo Clinic. And there were 178,971 electronic medical records that were reviewed, and 1,407 of that large group were confirmed patients that had the COVID-19 infection. And they met the inclusion criteria, and we are focusing on only outpatients with this particular database. And what they were looking at were two specific groups. They were looking at patients who had COVID-19 symptoms from day 0 to day 10, and then looking at a separate population of patients that had symptoms that were 61 days or longer. They also took a look at the variety of symptoms, whether these symptoms formed particular clusters together, and they were using this information to see if they can find predictors of patients who might become long haulers. In this particular study, again, there were more females represented. 72% were between the ages of 30 and 70 years old. And there were multiple races involved. You can see 54% were Hispanic, 26% were white, 10% were other, 6% were Asian, and 4% were Black. 27% of those patients did mention that they had persistent symptoms lasting longer than 60 days. On the right-hand side, you can see that a majority of the patients experience these symptoms that are listed. And I did list these for you in order of priority. In other words, the ones that were more common are going to be in the upper left-hand side. So dyspnea, cough, fever, chest pain, diarrhea, anxiety, and fatigue were more common than the other ones on the other side. For instance, the anosmia, which is where people say they had an altered taste, or the dysgeusia, which people said they had an altered smell. We do hear about that, but it was actually less frequent than those other symptoms on the left. Patients who had symptoms lasting longer than 61 days included this list on the left-hand side. And again, they are in descending order as far as how frequently they occurred. And on the right-hand side, you can see these symptoms did form 5 different symptom clusters if you had symptoms lasting greater than 61 days. There were the chest pain and cough patients. There were the dyspnea, which is shortness of breath and cough. We had anxiety and tachycardia, or rapid heart rate. We had abdominal pain, nausea, and low back pain, joint pain. Those were the 5 different symptom clusters of those longer symptomatic patients. So from the UC Cords data, there were 3 main points, what they call the takeaway points from this database in the actual study, if you read it. One of them was that common features were found in these long haulers. So some of the common features that they found from this population that they studied were that there were Caucasians, there were females, there were initially asymptomatic patients, there were people with normal BMI, and the BMI was between 26 and 33. And we had patients between the ages of 50 to 59, plus or minus 20 years, which did comprise approximately 72% of the long hauler population. The second takeaway message was that symptoms experienced among the long haulers would change over time. And this change could be a reflection of a possible limitation of the study. And it was acknowledged in the study that maybe the questionnaires that were used may not have been given an accurate reflection of what the patients were going through. The other thing about the questionnaires were that when the asymptomatic patients were filling out the questionnaires, they may have been less intently monitoring those patients because they may have thought that those patients were not going to proceed to have serious illness or severe long-term illness. And we have to remember that in this particular study, 32% of these long haulers were initially asymptomatic. So that's a really large number. Patients didn't feel anything until later, which is a very remarkable finding. And the symptom clusters that we just finished discussing, those 5 symptom clusters, might help us uncover the underlying sites of evolving tissue damage. It also might help explain some of the alterations in our innate and adaptive immune system and the inflammatory pathways involved that then lead to these long hauler syndromes. And the third point, which is a little bit less dramatic, but they made a point to state that the third point was that all ethnicities were affected, including initially asymptomatic patients. So it didn't seem like there was a particular ethnicity that was excluded. So if we transfer over to another topic of just understanding the pathophysiology, in other words, what disease process is occurring with these COVID-19 patients, then we can start to make our way to the conversation of how integrative medicine modalities might be able to help prevent a COVID-19 infection, help speed the recovery from both an acute process and from also reducing the likelihood of becoming a long hauler patient. So let's just go through this slide very quickly so we have an understanding of how people become ill. First of all, you have respiratory droplets when you're closely in contact with somebody who is infected. But these infected patients may be asymptomatic. They could be asymptomatic and you're catching them before they become symptomatic. And you can also come in contact with people who are currently having symptoms. And what we do know is that it usually takes about 5 days on average from the exposure to begin to manifest symptoms. if you're going to manifest symptoms. Remember that 32% from the UC Cords data that didn't manifest any symptoms until later, the 61 plus days. So the underlying chronic conditions that can greatly increase your risk for having a more severe COVID-19 infection could be as a result of this excessive inflammatory response, from the endothelial lining being dysfunctional, from having specific immune dysfunctions, and these could definitely lead to, again, a more severe COVID-related disease process. So this coronavirus infects the cell primarily by getting through a receptor we all have on our cells in certain parts of our body. It's called the ACE2 receptor. It goes inside, and then once it goes inside through this receptor, it activates many other cells that have the ability to release a lot of cytokines or inflammatory molecules. And you kind of get this very robust response. And these inflammatory cells can cause what we call a cytokine storm, just this very large amount of inflammatory molecules that are all over the body. And that cytokine storm, along with endothelial dysfunction, can be involved with this multi-system inflammatory syndrome that this coronavirus can cause. And it can definitely affect multiple organs and lead to multiple organ dysfunction. I do want to mention also that although the lungs are a primary site of injury for COVID-19, COVID-19 infections can involve many different parts of the body. And that is why we have a variety of different presentations among patients. So how can we use our integrative medicine knowledge and experience and literature to help prevent COVID-19 infections and to help these patients who have been infected have a quicker recovery time? So in order for us to even begin this conversation, we have to be very clear that at this moment in time, at least in the United States, there are no randomized clinical trials using integrative medicine modalities. And I will say that even last night, I was pulling up on PubMed whether or not other countries are using integrative medicine modalities and doing randomized clinical trials. And I'm happy to report that in China, I came across a study that was looking at glycyrrhiza, which is a plant, and vitamin C in combination, and doing a randomized clinical trial with those two natural elements. But we are thinking about doing these things because we know that there's quite a bit of literature that is coming out to try to understand how these natural therapies can very much beneficially help patients with this infection. And what we do is we use information from other forms of viral infections. So the coronavirus 1, which caused the SARS epidemic, influenza viruses, there are literature to support that some of these integrative modalities can be very helpful. So when we're dealing with COVID-19 acute treatment, it is a balancing act. We need our immune system to have a very powerful antiviral effect to contain the virus and to reduce the amount of replication. And we also need that when the virus enters our cells to not have this exaggerated cytokine storm. Just a certain amount would be helpful, but not an overabundance of it that can cause collateral damage. So during acute infection, antiviral support will be a key factor in that therapy. And when we're dealing with people who have longer symptoms, we're going to want to try and downregulate the inflammatory process to try to get them healthier. So some of the major categories of the integrative medicine modalities that we will use would be including healthy diet, physical activity, sleep, and immune support. As an integrative medicine physician, family medicine physician, I use many of my decision-making processes by using the literature and the scientifically validated information on these natural therapies to help guide my treatment. I also factor in patients' inflammatory responses. I look to see whether or not they have had any lung injury. Do I need to focus on that as part of my priority treatment program? I also want to see if they have any nutritional insufficiencies in their vitamins and minerals and cofactors. I need to see if their stress levels are high. Do I need to focus on reducing their stress? I need to ask them about their sleep. both quality and quantity of sleep. Many people suffer from sleep disorders going into this infection, and that could probably put them at increased risk for becoming infected. But then the infection itself can cause sleep disorders too. And then I need to also take a look and see how they're doing with their energy and identifying whether I need to support that energy. So customized approach and a synergistic approach that works alongside conventional medical interventions and therapies would be my priority when working with patients. When we're looking at the diet specifically, I gave you a list here in this slide to be quite comprehensive, but you want a low glycemic or low sugar load diet. You want to have low saturated fats and very nutritionally dense diet. So a Mediterranean style diet, Asian style diet that has many of these nutrients that are listed here. And if you have an abundance of these nutrients, you're going to have foods that are rich in amino acids, B vitamins, vitamin C, some minerals, vitamin D. And if you don't get enough from the diet, that's when we can implement some bioavailable customized nutritional support in supplementation if needed. Very specifically, vitamin D has quite a bit of literature, and there are quite a bit of studies that support vitamin D, and specifically with COVID-19. It is an antiviral, anti-inflammatory, and immune-enhancing nutrient that we need an abundance of, and it definitely enhances the functioning in the lungs to help immune regulate. The adequate amount that we want is based on our serum 25OH vitamin D, and we want it to be between 50 and 80 nanograms per milliliter, and the dosing will be between 300 and 4,000 IUs a day, taken with meals because it is a fat-soluble vitamin. We also like glutathione because it's the most abundant antioxidant in the lung epithelium, and its antiviral, anti-inflammatory effects, as well as improving vitamin D synthesis and receptor activity, will also help people recover from COVID. It improves the natural killer cells, which kill off viruses, and it can be given orally or via IV. And we do have IV infusion of services at our SSIHI. And doses are going to be between 250 and 1,000 milligrams, again, customized to the patient's needs. Melatonin is not just for sleep, but it's also an important antioxidant, anti-inflammatory, immune modulating molecule. We make the most of it when it's pitch black and we're sleeping, and we do make less as time goes on. Chronologically, as we age, we make less. So we have to make sure that people are going to bed at reasonable hours and making sure they're maximizing their melatonin. But we can supplement with 5 to 20 milligrams. I have 2 milligrams to 20 milligrams here because some people may be very sensitive, and you can benefit from a low dose as well. Cordyceps mushrooms is a type of mushroom that's an antioxidant, antimicrobial, and anti-inflammatory agent. And there was a study in November 2020 that identified that the cordycepin destabilizes the COVID-19 RNA, which inhibits its viral replication. And it also has a high, strong binding affinity for that spike protein that the vaccinations have been targeting. And this is something that we can use, and mushrooms are things that are part of our food groups, and we can have 1.5 to 3 grams daily as a very therapeutic dose. Astragalus has been used for long periods of time. There's over 2,000 species. Quercetin is an example of one, and it has immune modulating beneficial qualities. It's anti-inflammatory, it's an antioxidant, and it's very important that you work with a particular provider who knows how to dose astragalus, because you need the right genus and the right species and the right dose. Hydration is obviously very important whenever you're fighting any infection. It's recommended that you drink between half to your full body weight in ounces of water. So do not drop below half of your body weight. And we had an example of for a 160-pound person, that would be 80 ounces of clean filtered water. And it's usually non-caffeinated fluids, but I did put an exception. The exception is organic green tea, because green tea itself has quite a bit of beneficial health qualities. So those ounces of green tea would count towards those total ounces of hydration. Other modalities that can be very helpful are breathing exercises, deep diaphragmatic breathing, slowing down your breathing, focusing on your breathing, very helpful. Gentle exercise and advancing your diet is tolerated to moderate exercise can be very helpful, but be careful when you're acutely ill And if you are one of those long haulers, if you exercise too much, it can throw you into an exacerbation of your symptoms. So be very mindful to dose your exercise that's therapeutic for you and you recover by the next day. Stress management and mindfulness is very helpful. Good sleep practices, and as I mentioned before, quantity and quality of sleep is very important. Going to bed at the same time, sleeping in a dark room, no flickering lights anywhere, quiet atmosphere, relaxing routine before you go to bed are all very helpful for a good sleep program. Lavender essential oil aromatherapy can help reduce stress. It can help prepare you for sleep, help you relax before you go to bed. And spending time in nature, grounding, which basically means your body, your skin is in contact with the ground, whether it's sand on the beach or dirt in your backyard or grass at a park. All of those are very helpful. Calm music, calm sounds are also very therapeutic. And I don't want to forget to remind you that in your swag bag, we did give you a wellness journal. So you could take time to journal, take time to write down some of your thoughts, work through some processes. That could also be very therapeutic. These are my references on the following slide. This type is small, but if you wanted to pull up any of my references, you can. And I just want to personally thank you for attending this lecture. And hopefully you learned some more information regarding COVID-19. Thank you.